Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share this week's update on the COVID-19 pandemic for the week of August 2nd, 2020. As you know, we've been following this pandemic for some time. In late January, the World Health Organization declared it an international emergency of public health concern. At the time, there had been 130 deaths. By the middle of March, they declared it a pandemic. There had been a little over 5,000 deaths at the time, and then the numbers have been skyrocketing ever since, growing inexorably over time, week over week, such that by this week there have been over 689,000 documented deaths and 18 million confirmed cases. But as we've pointed out before, this is a tremendous underestimate because there are many countries in the world that simply don't have the infrastructure to do the testing, the evaluation, or the reporting. Additionally, it's important to understand that the pandemic is evolving differently in different places. Think about it starting in different places at different times. In Belgium, we've seen this pattern where it grew rapidly and then leveled off, and we've seen relatively little growth in the past 2 months. Compare that to the United States, which has slowed down a little bit, but is still growing, and compare that to Brazil, where the numbers are going up pretty rapidly. I'm not picking on those three countries for any reason other than that they give you a picture of how the pandemic is still evolving differently in different parts of the world. Perhaps the most interesting way to do that is this is a month ago. I put together a list of the 25 most impacted countries in terms of deaths per million population. The ones in white were European countries, blue was North America, and pink was South America. If I do the same thing today and color code it the same way, and I put them side by side, you can see that what's happened is the South American countries are growing much more quickly. Belgium is still at the top, but has grown very little in the last month in terms of deaths per million. But look at Peru, that was down in 11th place with 300 deaths per million, now up almost doubling that amount. Even look at the bottom number, the number it took to be in the top 25 has more than doubled. The U.S. has gone down one place from 7th to 8th in the world, but has gone up 77 deaths per million, which represents about 24,000 additional deaths just in the past month. So in addressing the U.S., as we've mentioned, the first deaths were reported in March. The numbers have been growing quickly ever since, week over week, such that we've now passed 150,000 deaths and over 4 million confirmed cases. And as I always do, I want to remind us that COVID-19 is an important cause of death. In the first 6 months, we would have estimated about this many deaths from the 10 leading causes of death in the United States, and COVID-19 would come in third place. So it is a significant pandemic. In the U.S., the number of cases grew rapidly early on and then leveled off and then grew again. I'm always hesitant to use cases because it's dependent, at least in part, on the number of cases, number of tests that are done. So I look at deaths, and early on we saw a significant increase in the death rate week over week. So that, that week it went 6.3% from the week before. Then it starts to level off, and then it starts to pick back up again. So what we're seeing is a rate that was very high in the early part, is seemed to be slowing down, but is now leveling off, in fact, even coming back up. So we're not seeing that kind of level, mature epidemic that they're seeing in most of the European countries. And in fact, our numbers seem to be going up a little bit week over week. In terms of deaths, you can see this pretty clearly. It's skyrocketed early on and slowed down and now been coming back up for well over a month. The same is true with hospitalizations. We were watching a rather significant rate, and then it started to fall week over week, and then has been growing again ever since then. Again, the same kind of pattern. What we want to see is we want to see this leveling off and approaching zero. Instead, it's not only not leveling off, both for hospitalizations and deaths, it's actually going back up a little bit. Again, this is reflective of the fact that the pandemic is affecting different areas differently. New York, one of the most heavily impacted states, as you can see, has that mature pattern that we saw in Belgium. Virginia, a state that's about in the middle of the pack, has a pattern that looks much more like the U.S. overall. And then Tennessee is growing. And again, I'm not picking on New York, Virginia, or Tennessee, but here are the 5 most impacted states versus the 5 median states in terms of their percent increase over the past month. And what you can see is that those states that were most heavily impacted, New Jersey, New York, Massachusetts, Connecticut, and Rhode Island, have seen relatively little increase in the past month, whereas those states in the middle are seeing a significant increase. And what this tells you is that as the pandemic goes into new areas, it explodes in those areas and then hopefully slowly levels off. And just for comparison, there's Tennessee over the past month with a pretty significant increase in number of deaths. So the way to think about this is that there are multiple evolving pandemics in different parts of the world and different parts of the state. Each of them is contributing to the overall pattern. And unfortunately, we're not out of the woods yet. It is still very important that we practice all the things we know make a difference in slowing this pandemic. Isolating ourselves when we can, wearing masks, staying socially distant away from folks, good hygiene, and so on. There's a great deal more information about COVID-19 on the College of Public Health website. You can go to the website and click this icon. Or if you have any specific questions, please feel free to let me know. I'd be happy to try to find an answer for you. Thank you very much.